All right. I was told there was going to be staff here to moderate, but maybe they're tied up somewhere else, so we're just going to go ahead and get started. My name is Mike Sevilla, and I know this is the last session of the day, so I know everybody's just kind of trying to fall asleep a little bit, so I'll try to keep people awake. That's my one goal. My second goal is to talk about social media in the patient-centered medical home. And you're probably asking yourself, what's a guy from Ohio? I'm from Salem, Ohio, which, not Salem, Massachusetts. That's a whole different place. So I'm midway between Cleveland and Pittsburgh, right on the Pennsylvania line there. And I'm a family physician with 4 other family physicians in our practice. We're in a small community. Our population is probably about 5,000. We have a small community hospital, about 100 beds. So that's a little bit about me. But how I got here was some of the staff from Quality Accounts came to see me speak down in Austin back in the fall. I was at the Aligning Forces for Quality national meeting there in Austin, Texas, and they saw me talk about social media, and that's how I ended up here, so I want to thank the organizers for that. This person here, this is Susanna Shepard. She works for the Mayo Clinic in Arizona, and I bring her up because she's going to be doing a webinar for Quality Accounts on Tuesday next week. So she's going to be talking about a lot of similar things that I'm talking about. So if you're interested in this topic, there is a webinar on Tuesday next week I encourage you to check out. So, and of course, why I'm here in Maine is because of the weather. My wife and I have been up in Bar Harbor in Acadia for the past few days. And is the weather always just great up here? Because my wife is in the back there, so we've been enjoying the hiking and biking up there in Acadia. And this was a couple of days ago on just a crystal clear day up there in Acadia. So we just had a great time. So we've been having a fun time. Actually, we'll be going there after this. So it's just been a great week up here. So what is social media? When I talk to especially physicians, and as you know, physicians are the most open people to change, as you know. They say, Mike, social media, it's all about, it's about what you eat. And I show this up here, it's Twitter, I'm eating a donut, Facebook, I like donuts, Foursquare, all that kind of stuff. And I can always check out the kind of the social media literacy of my group if I hear giggles coming out, if they know what they're talking about up here. But the other thing I get about social media is about posting embarrassing pictures on the internet, like this one. You may have seen this back at the inauguration a few years ago, and I'm not going to explain that. You can probably explain it yourself out there. So this is our practice. I've been there about 10 years. The first thing that I tell people about social media and medicine is that I do not use social media at all to communicate with patients pertaining to patient care, okay? And the only recommendation I have with that is if you are on like a secure email, like through a patient portal type of thing, then that's all right. I mean, I have some friends say, I text message with patients, and I mean, if that's okay with you, I mean, that's fine, but I really hesitate for doing stuff like that, emailing patients on a non-secure type of email. I don't Facebook with patients, I don't use Twitter with patients. So I will tell you what I do use social media for. I've been on social media for almost 10 years now. And I've been teaching social media literacy for about 5 years, especially physicians, because they're as you all know, the most resistant group for any kind of change whatsoever. And it's been an interesting take. It's been an interesting journey for me for that. I have a website here, drmikesevilla.com, and all of these slides are on that site. There's also a handout at Quality Accounts website for some more information about social media and about this talk. About 3 or 4 years ago, I was interviewed by Medical Economics as kind of a leader in this area as physicians using social media. And back at that time, this was about 3 or 4 years ago, and it was an interesting question that they had. It was an interesting question that physicians had and providers had at that time. Do you friend your patients on Facebook? Obviously this is talked about a lot now, but 4 years ago, people were like, what? What are you talking about? But there will be times when I would come home, from a long day at the office, and I see this friend request, and people who work in offices, you may have seen this as well. And what do you do about this type of thing? And for what I type of do is some physicians or some providers are like completely no, some are I have no problem with it. Me, I'm kind of in the middle. I have a lot of friends who I was friends with, before the internet, before Facebook 4. So I selectively do friend some of my patients on it. Now, there is no kind of rule about that. I am going to talk about social media policies for your office, for your clinics, which I think is very, very important. But that's kind of what my take on it is. And now I do some interesting kind of things on social media. This is kind of what you call a Google Hangout, which is kind of a video conference. It's kind of a conversation on the internet. This is a great group out of Stanford. They're called Stanford Medicine X. They do a lot with technology. They do a lot with patient advocacy. They have an annual conference out at Stanford. So this is a great group of people who are doing a lot of patient engagement as well, in addition to technology. So I encourage you to check that out if you can. So this is what we're talking about. So I'll do my little quick survey here. How many people are on Facebook and use it? Okay, how about Twitter? Okay, how about LinkedIn? How many use LinkedIn? Oh, people use LinkedIn. Okay, Pinterest. People like Pinterest. Yeah, people like the Pinterest. You got to teach me about that. I don't really get into it that much. But how about professionally? How about your clinics or offices? Are they on Facebook at all? Anybody out there? Okay, great, cool. So why is the internet important for you working in offices? This is from the Pew Research Center, the Pew Internet American Life Project. And here's a couple pieces of data for you. 59% of U.S. adults have looked for health information in the past year. And 35% of adults have tried to diagnose themselves. You've never done that, have you? No, we're all professionals here, right? I mean, you also know that 90% of what on Wikipedia is wrong. Okay, this came out a couple of weeks ago. So this is an interesting opportunity for you interacting with patients to engage them in what they are finding on the internet. I mean, most of it is wrong. So here are some of the goals here that I'm going to be talking about as far as social media, for use in clinics and offices and professionally. Now, the first thing that I tell people is that, they tell me, Mike, I don't have time for this. I don't have this time for this checkbox thing. Who am I going to assign this job to? I have 15,000 of things I have to do. What I tell people in clinics and offices is, what is your current communication plan right now? Do you use newsletters? Do you use flyers? What do you use? And just think of opportunities for social media to be an extension of that. And for people who were here for the last session, talked about messaging. Who is your audience? What is your message if you're going to use not only social media, but any kind of communication device? So if you're going to put a post up on Facebook, who are you directing it to? What is the message? Because I have patients, every time I go in my office, we have a rule in our office, don't use your phones, but when you come in, they're using their phones. And what are they doing? They're checking their Facebook. Okay? Now, can't you see an opportunity? There's an opportunity there for healthcare, for your clinic, for your office, to put information up there. Things like, we got our flu shots in this week. Or if there's something local going on in your community, like a meningitis outbreak. Here's some information about meningitis that you need to know. If you want more information, call our office or whatever communication you do. It's a real opportunity for clinics to be that kind of, health champion in the community using social media. And it's free. So you can use pictures, you can use photos. I do have some examples here, but I do have examples of clinics who put pictures when they do their outreach events, when they go out into the community or when they volunteer at a soup kitchen or even doing social events. They're having their, softball game in the summertime. They put those pictures up there. It makes them feel, more connected to the community, and patients feel more connected to the community. So those are opportunities that you can market your practice. In storytelling, for people who were at the previous session, it's an opportunity to tell a story as far as, why I love coming to this practice, why I love team-based care. You can engage patients, you can engage staff members. It's a powerful way to use this communication medium. And just a little bit of thing about Twitter conferences. People are real hesitant about getting on Twitter and like, what is this tweeting thing all about? At conferences like this is a great opportunity to ask people, who are doing it. I use it to take notes. I just posted this morning. I was in a session about patient engagement. And you know what happened? I tweeted this out to my 17,000 followers, and I had one follower who's a physician in the Philippines tweet me back. He said, Mike, these are some really interesting concepts. We should be doing some of this stuff. So Twitter at conferences is an opportunity to get the conference outside of the walls of the conference. It is an opportunity to get a conversation potentially worldwide. This is a family medicine conference that I was in last month. And this is very complicated, but you can see the amount of tweets here. This is like 500 during an hour's time. And these are all the people who participated in it. I'll tell you, most of these people were not physically at the conference. They felt engaged with the conversation. And I can tell you, I don't have any, this isn't evidence-based, but anecdotally I can tell you that when people are more engaged in the conversation here virtually, they make time the next year to come in person. I have had organizers tell me their registration goes up because these people feel engaged, they feel heard. But especially for providers and physicians, I can't take time off, blah, 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 A, B, C, D, E. This is why I can't go in person to the conference. But if they get engaged in the conversation here in Maine, they feel like they're engaged. They feel like they're part of the conversation, and that makes them want to come here. And this is also a complicated slide here as well. But this is kind of the impact of what a bunch of people tweeting or having a conversation can have. This is kind of the reach of this conference. And I can tell you, 4 years ago, I was only one of 5 people tweeting at this conference. So how do you get people to do this? It's just getting people interested, getting people engaged. And for this group, this is my professional association, American Academy of Family Physicians. It got people on the staff, it got people on the leadership, it got people on the board of directors itself to really kind of take interest to it. So it really takes not only grassroots, but a kind of top-down, trying to do some of this social media stuff. A big shout out to Quality Counts. Here's why you should follow them on Twitter and like them on Facebook, because they have this haiku thing that they've been doing for the past couple of weeks, which is really, really creative. They have been having one like almost every day for the past couple of weeks. And it's creative, it's fun, it's not boring, and it's a way to keep people engaged. It's a way for people to get interested in what they're doing. And then, so when they have their other type of content, people will be interested and interact with it. So I encourage you to like them and to follow them on Twitter. It's good stuff. So here's why you're here. Here's why I use social media. Okay. I use social media for patient education. I use social media for dispelling myths. I still have parents coming in arguing with me about vaccines and autism. Still now. Even though it's been debunked, the guy's lost his license, he's almost thrown in jail. Doctor, that immunization causes autism. Why did that happen? That happened because the medical establishment was not prepared for the internet buzz that happened when that first study came out. We, as a medical community, were not ready to respond to that. So people like the Jenny McCarthy's of the world were able to say what they had to say, and there was virtually nobody out there to respond to it. And it's taken a long time to try to turn that around. So dispelling myths, I use social media to dispel myths. I get to find out what happens every day on Dr. Oz because my patients ask me about it, which is fine because they come in, we engage in a conversation, and then we can see what's right and what's not right, what's evidence-based, what's not. So I see it as an opportunity to engage the patient in conversation. But what I'm going to be talking about the most here is using social media for advocacy, using social media for storytelling, using social media to tell the story of team-based care, patient-centered medical home, advanced primary care, whatever you want to call it. Because we need to do that. We need to do that because if we don't, nobody else will. And social media is a great way to do that. This is my friend Jason Rowe. We were in residency together. He's in practice out in the Toledo, Ohio area. And he's an example of somebody who effectively uses social media, especially his Facebook page. And I know you can't see in the back there, but he posts stuff like, how to know when your cough is serious, physical activity guidelines as far as exercise, don't text and drive. So those are things that you can easily put on your Facebook page. Maybe you're already doing it. Maybe you have a newsletter that you put out periodically. You can just put it on your Facebook page as well. It's not a lot of duplicative work. It's just kind of extending your current communications plan. Patients are using social media. This is my friend Carrie Sparling. She's a patient with diabetes in Rhode Island. And if you don't know the diabetes online community, that is a very powerful social media community because they use these tools very well. And she started her blog called sixuntilme.com. She started her blog because she thought she was the only person in the world with diabetes. And she wanted to reach out to see if other people had this. So I'm going to play a video here for you, and I'm going to show you why video is very effective in social media. So why is that good? I mean, it's genuine, it's first person, it's funny. I mean, we all could do that. I mean, she just did it with her iPhone. People think you need this huge, production and these expensive equipment and blah, blah, blah. With their iPhone. I have a lot of docs, whose staff has urged them to do this. But their staff records them on their iPhone and say, hi, I'm Mike Savella of Salem Family Practice. And, I just want to talk to you today on this short little video about, why the flu shot does not cause the flu. Because during that time, I get that thing all the time, But I have docs that say, I say that 15 times a day. I'm like, great. Get your iPhone, record it, put it on your practice website, because, in case you're running late, because you don't have any providers that run late, right? That never happens. So, does the flu shot cause the flu? The short answer, no. The long answer, go to the website. Because I also have some footnotes, I have some evidence, I have some other information. Watch it. When you come back, we could talk about it more. So, it's another way to communicate using social media. People have heard of this. How many people have seen this or heard of this? Okay. There was this whole kind of discussion on the internet about this hashtag advocacy. Is this really effective? And depending on what political bent you're on, you had differing opinions. But my thing about this is that, using Twitter, using Facebook, using social media for advocacy, trying to raise awareness out there, I think is a good thing. And here's an example for a primary care setting. This is a primary care progress based out of Boston. Okay, great primary care advocacy group. What they did a couple years ago is that they had this photo campaign during what was called National Primary Care Week, which is in October every year. So what they wanted to do is they wanted to raise awareness of primary care, show everybody the value of it. So what they did was they put this blank sign, it says primary care, on their website, and they asked people to write something on it about primary care. And this next slide, this will be the most important slide that you'll see today. This was one of the first people who did that. Okay? So, you can kind of see the emotional connection in the room. You can see what social media, you can see what a photo campaign can do. And from anybody's standpoint, especially from a physician and provider standpoint, this is pretty low buy-in. Dr. Sevilla, can you write something down and put it up? We're going to take a picture with my iPhone. There's no blog post, there's no video, there's no nothing. Easy way to get buy-in, to get people to believe in social media. Here's some other people who wrote for the project. And you notice a lot of younger people here. You need to find that social media champion in your office and in your clinic. Someone who's going to push this here a little bit, okay? Now, you may need some technical help, okay? But, I talk to the younger people all the time, especially college students, medical students who rotate in my office, residents. Social media is like breathing to them, okay? It's here. It's just when you're going to get on board. And your patients are doing it all the time. Might as well just be proactive about it and learn about it. There's also these really cool social media communities out there. I mentioned, patients. There have been support groups forever. But then they've taken it to the internet and made it digital support groups. But then there's all kinds of groups out there that you can find, that you can interact with, that have discussions globally. This is ours. It's called FM Revolution, or Family Medicine Revolution. It's our little family medicine activists out there who encourage each other out there. We talk about things on the internet like legislative advocacy. Every time they talk about, Medicare cutting, we're like, argh! We encourage each other to, talk to legislators, when there's important things that come up. That's a way for us to communicate. It's a way for us to kind of just, maintain our energy. Because when you go to these in-person conferences, you get all this energy. Then you go home and you're like, ugh. But the internet is a way to for you to keep connected. It's a way for me, like every time I'm having a bad day, I go search this, my hashtag there, and like, oh, these are the great things that people are doing. These are people that are encouraging me, my friends, my colleagues, to continue, doing family medicine and primary care, taking care of patients, partnering with patients. So there's a lot of internet communities out there. There's even opportunities out there for fundraising. This is my friend Rob Lamberts. He's in Georgia, and a few years ago he started a direct primary care practice. So it doesn't accept insurance, contracts directly with patients. It's one of these new models that are out here. So what he did was, I have a lot of overhead. So he thought of, is there a way to ask his community out there to say, hey, can you help me out with some servers or like some cost for this and cost for that? So there are a lot of these funds out there, like GoFundMe or Kickstarter or those type of creative type of things. And it may not be for everybody, but fundraising always needs kind of a creative type of thing to try to get started. So I just mentioned that just as an interesting option. This is the second most important slide I'll show you today. Back 5 years ago when I started doing this social media literacy, I would go to conferences and doctors would make fun of me. Well, they do now, but for different reasons. But like, what is this social media? It's like for kids, it's a fad, it's going away. So what I would tell them, I would go to the computer, I would say you have to turn it on, and then you have to use a little thing, it's called a mouse. And then go to Google, type your name in, what do you get? And a lot of doctors back then, providers, say, hey, that's not my Family Physician of the Year award that I won last year. No, it's not. It's a physician rating site. And a lot of doctors didn't know that. But also hospitals, clinics, offices are also on these rating sites. And a lot of people don't even know they're there. And the only reason they find it is because the patient will tell them, hey, I tried Googling your clinic, and I got this thing here, and I didn't like it. So online reputation is a huge thing these days. So you have to have some kind of online presence for your clinic, for your office, if for anything else to get the right information. Some of these things have the wrong information. They have the wrong telephone, they have the wrong address, they have the wrong fax number, so people get confused. So, especially from a business standpoint, you have to have the right information out there because when people try to find you and try to Google you, you have to have the right thing out there. The other thing, too, on the flip side is that I have had a lot of patients, a lot of new patients find me. They said, well, why are you a new patient? Well, Dr. Sevilla, we Googled your name, and we Googled family medicine, and we Googled Salem, Ohio, and you were the first person there, and that's why we're here. So I tell physicians that, and they perk up, and they're like, oh, business. So online reputation is important. So if you're not online, if your clinic, if your office is not online, I would encourage you to at least consider that. Okay, here's the bad stuff. Because when people talk to me about the social media, they're like, okay, there's all this bad stuff out there. This is not what I'm doing it. No, 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 no. So I'm going to have a few slides here on the bad stuff. Okay, the bad stuff does happen. Okay, this is a physician in Rhode Island. This was 3 or 4 years ago. And this physician thought that they were anonymous, or they de-identified all of the patient information when they made this disparaging Facebook post. So what happened? So what happened is the people at the hospital figured out who this physician was. And they were fired. Duh. So, don't ever, ever, ever talk about patients on social media, ever. Here's another example. This is a nursing student. This was like 5 years ago. This is a nursing student, and this is a placenta. So she was excited that this was her first delivery, and she put it out there. And, obviously, her friends were like, oh, yeah, it was, your first delivery was great. Not great. So she was kicked out of school. But she appealed and got back in. Why did that happen? Because the school did not have a social media policy telling her that was a bad thing to do. Get it? This is the most egregious example of bad social media. This was about 5 or 6 years ago when I started on the internet. This is a pediatrician out of Boston. And when I started on the internet, I had this great blog called Dr. Flea. It was anonymous. He did not identify himself, but he talked about patients. He talked about patients to a point where he was blogging during his malpractice trial. Great reading, let me tell you. What happened? The other side found out, and in this TV moment, he was on the stand. Are you Dr. Flea? Yes, I am Dr. Flea. The case was settled the next day. So what are the lessons here? 1, don't blog during your malpractice trial. 2, don't ever talk about patients on social media. Even if you think you have removed all of the identifying information, people will find out. So I've been talking about this social media policy. If your office doesn't have one, you have to get one. I direct people to the Mayo Clinic. Mayo Clinic has a whole center for social media. They kind of have boilerplate type of policies. For example, what if a patient talks about a staff member on social media? What does your office do? Have you thought about it? What if your staff member talks about a patient on social media? Do you have a policy for that? What happens? Gets into a lot of legal type of trickiness there. So the one takeaway that I have is, online reputation. If you don't have a social media policy for your clinic or office, you should look into one. Because there's going to be a situation that comes up where it's going to be tricky, there might be lawyers involved, and it's just going to be messy. So before I go, I just wanted to share a couple of sites. If you know nothing about healthcare social media, this is Dr. Kevin Foe, kevinmd.com, the leading blogger in the world. He was out there even before me, probably 2003, 2004. He talks a lot about healthcare policy. He's from Nashville, New Hampshire. And this is my post today. I talked a lot, I like techie stuff, as you probably figured out. So I talked about this new app that Apple has, that they're piloting, that they're developing for, called HealthKit. So I talked about that today. He talks a lot about health policy type of things, and not only physicians. He's had attorneys post to his site, patients, people from insurance companies. It's a nice, well-rounded blog as a first stop if you want to figure out or take a pulse of what's happening in healthcare social media. This is Dr. Wendy Sue Swanson. She's a pediatrician in Seattle. Her Twitter handle is Seattle Mama Doc. And she was one of the many people who kind of launched her social media career when the vaccine and autism thing happened. She was like, I have to get out there and talk about this. And she's partnered with her hospital, Seattle Children's. She has a great blog that talks a lot about pediatric issues, immunizations, car seats, all that type of stuff. So this is a great blog too. She also has videos on her site as well. So if you're looking for great up-to-date pediatric information, she's great at that too. So in summary, especially if you have nothing on social media right now for your office or for your clinic, what is your communications plan? And how can social media amplify that? Okay, it doesn't have to be a checkbox. It doesn't have to be another additional thing that you can do, that you have to do. What are opportunities that you see that you can use, Facebook and Twitter to extend your message about your clinic, about your office, about primary care, about team-based care? You have to find that social media champion. As with anything, you've heard a lot of talk about change today. You have to find that change agent in your community or in your office or in your clinic to help drive this there. There's no one else that's going to do it. What's your social media footprint? What is your online presence? Not only for yourself personally, but professionally, for your office, for your clinic, for your hospital. What are you passionate about? Of course, team-based care, primary care, but there's maybe some other things that you're interested in that maybe other people aren't. Pediatric care, women's care, geriatric care. That's stuff that you can feature, showcase on your social media presence. And tell your story. That's one of the common themes that I've heard today, is that people have to tell their story. There's nothing more compelling, that with a story. You can add some pictures to that, you can add some data to that. But that story, that patient story, that staff story, that provider story, why primary care, why team-based care is great, why the patient-centered medical home is the best model out there. So my final video for you is social media can also be fun. It doesn't have to be all boring. This is a great way to teach sometimes a boring concept. You know, the guy's a real doctor? Internal medicine trained from Duke University. Now, obviously he's making more money now. But yeah, that was fascinating when I was doing this. The other interesting thing is huge organizations are using social media. This is the American Heart Association. 1.5 million views on YouTube for CPR. Yeah, it gets the message across. So that's all I have for you today. Thank you for your attention. I'll welcome any questions that you have in our last remaining moments. If anybody has anything, I know it's been a very long day. And this is my last slide. This is from Bar Harbor a couple nights ago, sunset, and I was fascinated by there's at low tide. There's an actual bar that goes to the island, and then there's things like trucks that drive on it. That was fascinating to me. I bored my wife for 20 minutes. There's a truck on here and it's low tide. Are they going to get back or whatever? So, but if you have any information, drmcsavillo.com. I'll be up here answering questions if you have any. But thank you for your attention. You've been a great crowd. Thank you.